You know that feeling when you wake up tired, even after a full night's sleep, when you push through your day running on empty, wondering where your energy went? Here's something most people don't know, that fatigue may actually be happening inside your cells. That's why I've been using anti-factor lipids powder from Nutritional Therapeutics for years. I don't go a day without it. It's based on over 20 years of research and a patented process called membrane lipid replacement, which actually repairs the damaged components of your cell membranes, restoring your cell's ability to produce energy the way they did when you were younger. Clinical studies show anti-factor can reduce fatigue by up to 40%. Just 1 or 2 scoops a day. Mix it in a smoothie like I do, sprinkle it on food, and you're giving your body the science of youthful energy. Anti-Factor Lipids Powder comes in 2 convenient sizes. For more information and to order, just call 800-982-9158, 800-982-9158, or go to antifactor.com. That's antifactor.com for Anti-Factor Lipids Powder.
Welcome to Intelligent Medicine. This is Leyla Weighs In, your week podcast where I weigh in on topics of interest, on your questions. I can help to answer them. I can take a deep dive on them. If you'd like to email me, questions@drhoffman.com. That is questions@drhoffman.com. I want to talk about perimenopausal symptoms, but specifically when it comes to muscles, tendons, joint pain. Many women experience actual pain in perimenopause leading to menopause, where it could feel like a tendon, muscle, joint. There are aches and pains that are happening. And in this particular journal, let's see here, it's the Integrative Medicine, a clinician's journal. They look at screening for insulin resistance in perimenopausal musculoskeletal care. This is a functional medicine informed framework. I found this interesting because this is written by a physical therapist. Tara Moore. She does a wonderful job. And basically, women in perimenopause, they commonly have symptoms of musculoskeletal complaints with new or persistent joint pain, muscle aches, and tendon-related symptoms. This is, it's pretty common during this time of life. The emerging construct of a musculoskeletal syndrome of menopause recognizes these symptoms, these presentations, as manifestations of a broader physiologic transition rather than isolated tissue pathology. In many settings, management remains centered on localized tissue rehabilitation, PT, maybe massage, something like that, but with less attention to systemic contributors that may influence recovery. Now, as a result, some women continue to experience functional limitations despite adherence to recommended strategies. One systemic contributor warranting greater attention during this life stage is metabolic dysfunction, particularly insulin resistance. During the menopausal transition, declining estrogen levels, declining estradiol alters insulin receptor signaling and glucose homeostasis. So this contributes to increased belly fat, called visceral adiposity, and reduced insulin sensitivity beyond expected age-related changes. Since skeletal muscle is the primary site of insulin-mediated glucose disposal, these shifts are directly relevant to musculoskeletal function and recovery. Now, furthermore, other data demonstrate worsening cardiometabolic risk across this transition. We know that with waning hormones, that you may be at increased risk for cardiovascular disease. And type 2 diabetes is associated with increased prevalence of tendinopathies. You know that tendon pain you get? Maybe you can't reach behind you to your back with your arms like you used to. There's pain, there's something, or your range of motion seems to have gotten smaller, right? Well, type 2 diabetes is associated with increased prevalence of tendinopathy and related conditions. Metabolic and inflammatory changes accompanying insulin resistance may intersect with menopausal connective tissue changes, potentially amplifying symptom persistence or limiting the rehab response. Like you're going through your PT, the rehab, all of that, but you're not getting the response that you should. You're not getting better, or it's short-lived. Now, despite these interrelationships, structured metabolic risk awareness remains uncommon in routine outpatient musculoskeletal evaluation. So, this innovation proposes a functional medicine-informed framework integrating early metabolic risk awareness into musculoskeletal care for perimenopausal women to enhance personalization and interdisciplinary collaboration. So this is very interesting. You've got, say, tendinopathy or tendon pain, musculoskeletal pain. You're going for PT. The PT is going well. You're getting some resolution of your symptoms, but it's not completely gone. Or you do get a resolution of your symptoms, and then after stopping PT, after a period of time, your symptoms kind of come creeping back. Well, what Tara Moore here is proposing is that there needs to be an insulin resistance screening. We need to be screening for metabolic abnormalities like insulin resistance, which may be a contributor to these pain syndromes, because we know in type 2 diabetes, there is associated risk with increased prevalence of tendinopathy and related conditions. And ladies, as you get into perimenopause, menopause, there is some more insulin resistance with that as the hormones wane. But in my view, in my opinion, as the hormones wane, we become more carbohydrate intolerant. But I really believe that we were eating too many carbohydrates to begin with. And now that we've reached perimenopause and menopause, we're really feeling the effects of that. Had we been lower in carbohydrates throughout at least the adult lifespan, you may not have any worsening of these symptoms. You may not have any perimenopausal or menopausal symptoms at all. That it may be due to insulin resistance. But what Tara Moore, who's a physical therapist, is talking about is that there is a metabolic abnormality relationship to these musculoskeletal pain presentations, these pain symptoms that are being experienced. So this framework applies a systems-based lens by considering medical history, lifestyle factors that contribute to insulin resistance and musculoskeletal dysfunction in perimenopausal women. Now, antecedents, things that happened before, may include an endocrine history. Maybe this person has polycystic ovarian syndrome. Maybe they had PCOS in their teens, 20s, 30s, right? Or long-standing sedentary behavior. That could certainly promote insulin resistance. And nutritional patterns that influence metabolic regulation across the lifespan. Common triggers during perimenopause include hormonal shifts, central weight redistribution. We're talking about belly weight. If you were a hip and thigh lady all of your life, suddenly belly fat is appearing where did this come from? I never had belly fat before. That may have to do absolutely with insulin resistance, eating too many carbs. That's what causes the insulin resistance. Other things, psychosocial stress, certainly, because that can increase cortisol and cause belly fat, and sleep disruption. We know that sleep disruption can cause some glucose intolerance. It increases cortisol, and that can also contribute to belly fat. So we're still talking about insulin resistance here. These factors may impair insulin sensitivity, increase inflammatory signaling, and reduce tissue recovery capacity. This is important. That maybe you need the whole full workup, even with the physical therapist or before you see the physical therapist, if you have a long-standing history of any of these metabolic abnormalities like PCOS, or maybe you've had metabolic syndrome in the past and you still do insulin resistance, all of these overlap. And now, during perimenopause, menopause, you're experiencing tendinopathies, decreased range of motion, muscle soreness, stiffness, joint pain, things that weren't happening to you before. It may have everything to do with insulin resistance because, these factors, they impair insulin sensitivity, they increase inflammatory signaling, and they reduce tissue recovery capacity. So you may be getting all this fabulous physical therapy, but if your insulin resistance is reducing your tissue recovery capacity, you're not getting the full extent of the benefit of the physical therapy, are you? So mediators sustaining dysfunction may involve chronic low-grade inflammation, impaired glucose utilization within skeletal muscle, altered collagen turnover, and physical inactivity, right? Sleep disruption, chronic psychosocial stress, these are common during perimenopause, and they may impair insulin sensitivity and amplify pain perception. So you would benefit from incorporating sleep hygiene strategies, restabilizing circadian rhythms, going to bed at the same time every night, waking up around the same time every morning, stress regulation techniques, appropriate workload management. All of these may enhance metabolic regulation. It would certainly help. And certainly if you're getting enough sleep, if you're dealing with stress the way you should, because a lack of sleep and stress, these can all add to or exacerbate insulin resistance from an already high-carb diet or a moderate carb diet for many people, especially if you're sedentary, right? So the systems pathway linking perimenopause, insulin resistance, and musculoskeletal care. Here's the thing. The perimenopausal transition is about declining hormones, declining estradiol, right? Hormonal variability, belly fat, right? And increased cardiometabolic risk. And then emerging insulin resistance, which is about impaired insulin signaling, reduced skeletal muscle glucose uptake, and impaired glucose regulation. Now, that could lead to the musculoskeletal manifestations, which is increased tendinopathy prevalence, persistent joint pain, functional limitations, and a variable rehabilitation response. Again, you may not be responding well to PT or other things that you're doing. And then that could lead to integrated rehabilitation approaches, like doing a metabolic risk assessment and progressive resistance training for symptom modification. So, an interdisciplinary referral when indicated. So, your tendinopathy, your muscle joint pain may not just be that in isolation. It may have underlying metabolic abnormalities that have been happening even for years. And now, during the perimenopause, menopause life transition, these symptoms are coming to the fore because of the waning hormones, the decreased estradiol, the decreased estrogen, progesterone, all of that, and those impacts on the body, right? So it kind of sets the stage for these tendinopathies to happen. So it's not just a matter of PT. Think about it. I know many women complain they're in pain. Their arms hurt, maybe their legs hurt. They can't reach behind them. They can't get dressed without some discomfort. Putting on you're pulling over your sweater over your head or taking it off, even more so. Hooking your brassiere or taking it off, reaching back there, right, to unhook and everything. Putting on your bathing suit, all of that. We're getting dressed never used to be a problem before, but now suddenly it's a problem. And a clue for many of you may be, okay, perimenopause, now I put on a few pesky pounds, maybe 5 pounds, maybe 10 pounds, maybe more than that. And you're wondering why, because you're eating the same way, right? Your exercise level is about the same. But guess what? Now it's been not just, 2 decades of your life where you're eating this way. It's not just 3 decades of your life. It's 4 and 5 and 6 decades of your life where now metabolic abnormalities have been catching up with you. Having a moderate to even a high-carb diet for most of your life. Add to that sedentary behavior because, hey, maybe in your 40s, 50s, 60s, you're not moving around the way you used to. Maybe you were a gym rat in your 20s and 30s. You love that. Maybe you were an avid runner. Maybe you were doing all kinds of different exercises that you enjoyed. And maybe in your 40s, 50s, life changes, workload, raising children, the whole 9 yards, grandchildren, all the things, right? They may have slowed you down, or you're not making as much time for exercise, or you find that you're less exercise intolerant, or you're less exercise tolerant, rather, than you used to be, or you find that you're having more trouble with exercise recovery. This is another common complaint for especially women. Men, too, in their 40s and 50s, is like, I don't recover as well. The muscle soreness is lasting longer. What's going on? What's going on here? It may be the underlying metabolic abnormalities. It is decreasing your recovery time, right? Or the other thing that may be happening is it's reducing your tissue recovery capacity. We need to address first if there are any metabolic abnormalities, like insulin resistance, metabolic syndrome, prediabetes, diabetes, all of the above, PCOS, and address all of that. And the only way to address all of that is not with medication, it's with nutrition. It's with nutrition and appropriate supplementation. That's how you fix it. The antidote is a low-carb diet, and maybe some appropriate supplements to enhance that for you. And then you will find that all kinds of inflammation is going away. Maybe you're having less headaches than you used to now. Maybe you're having less muscle pain now and joint pain than you used to. Maybe that tendinopathy is starting to ease a little bit, but maybe it's not gone all the way for you. Maybe you still have some discomfort. Once you've addressed the underlying metabolic abnormalities, and as long as you're addressing them, now's the time to go for PT. Because then that can bring on the rest of symptom resolution. That's really what you're looking for there. So if you're somebody who's had these bodily discomforts and you're going to PT and you're finding it's not helping, or it helped and now I got to go back because all my symptoms are back, you need to ask different questions. Am I insulin resistant? I want to thank you for joining me on another edition of Leyla Weighs In. This is Intelligent Medicine.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muedin, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.